welcome back to Medical Coding with Blue. Today's episode is all about, do you need medical field experience to study medical coding? If you are brand new to my channel, welcome. I am Blue, I'm a medical coder. Okay guys, so I got this really good comment from a viewer and I'm going to read this comment and then we're going to get into it. So here we go. All right, so the viewer says, "Hi Blue, I enrolled in a tech college. I have very little experience working in the medical field. I am very excited to see what my future holds, but will this hurt me if I don't have much background in medical office? I'm eager to learn about the medical coding and billing world. I just need some reassurance that I'm going down the correct path." Okay, so here's the thing, guys. You will find that in a lot of these programs, like if you're going through the online medical coding programs through the American Health Information Management Association or the American Academy of Professional Coders, you're going to find that there's not like a prerequisite as far as like they don't require you to have a degree in order to study these programs. What you need is a high school diploma or a GED, and then you're able to, of course, pay your fees and get in, right? But that's the thing. Medical coding is so unique in that it doesn't require the individual to have an advanced degree before, studying and getting a medical coding certification. So the burden goes to the medical coder to learn and to be able to pick up all of these things, because we do have to know a lot. I say this all the time. We have to know what doctors know while never having gone to medical school. This means that you have to be proficient in medical terminology and anatomy and pathophysiology, as well as physiology. You have to know all of these things so that you can better understand what you're reading. I see a lot of medical coders students that don't put much stock into learning medical terminology, and sometimes they're told by their instructors that, oh, you can just learn along the way, and not really put emphasis on laying the groundwork and having the individual learn medical terminology and anatomy first before trying to learn medical coding. It will make a whole lot more sense if you do it that way. If you learn it first, your medical terminology, your anatomy and pathophysiology, and then dive into the coding. But as far as having work experience, if you've been with my channel for any amount of time, you know, because I do talk about it quite often, that I came from no background in medical. I was so far away from the medical field, it wasn't even funny. And so I had no desires to do anything in medical when I heard about medical coding. When I heard about it, it was from my case manager. I went through the WIOA, or the Workforce Innovation and Opportunity Act. At the time I went through it, it was called WIA, but they have since updated it and changed it, and now it's WIOA. This is a wonderful program that if you are laid off or if you are in a low-wage paying job, they will pay for you to pursue another trade, and that was how I got into the program. I was going to go into accounting because I'm a numbers whiz. I love numbers, but fate stepped in and intervened in my life, and here I am today, a medical coder with my channel on YouTube with nearly 20,000 subscribers. Thank you to you all who have subscribed. And if you haven't already, hit that subscribe button and the like button. But anyway, that aside, that shameless plug aside, I want to let you guys know that no, you don't have to have any prior experience in the medical office. You don't have to, have any of these advanced degrees, but what you do have to do is be a really good student, and you have to be willing to not just learn while you're in the program and of course when you get your certification, but also afterward. The studying doesn't stop, folks. The studying does not stop. It is a constant thing. It is something that I have said and more here recently is I've been a student since 2008. I started school in 2007, but I got my certification in 2008, and I've been studying continuously since then. So if that tells you anything, it's hello. We are now in 2022, and I'm still studying. So there's a lot for us to learn, and but it's not impossible. It just takes a strong will and a desire to learn. You have to be very proactive when you're getting into this field. You have to be very proactive while you're learning, okay? Because just because you don't have this advanced degree, and just because you didn't have any medical field experience, does not mean that you can't be a high caliber medical coder. All right. It just means that you're going to have to work a little bit harder. And that's what I had to do. I had to work hard, and I've worked hard every single day since. And I enjoy this field so much that, of course, I make my own channel about it on YouTube talking about it because I want people to know there's a lot of things out there that people think, well, you know, can I do this? You know, should I do this? I've never worked in medical before. They let you in the program, didn't they? So if that was a problem, they wouldn't have let you in the program. That's number one. Number two, when you look at the job listings, what are they looking for? Experience, obviously, because they're all going to want experience. Employers want brand new medical coders to have all this experience, which is ridiculous. But they want people to have experience so they don't have to train. But in reality, a lot of times, even though they hire a veteran coder who has years of experience, they often need training as well, you know, because things are different at different places. And sometimes coders are not as well-rounded if they have many years of experience, but they've only coded in one type of specialty. So that's something else to think about. You know, if you're a brand new coder, you've just been trained in every single specialty because both associations, you know, on their medical coding exams, they cover all of the specialties. And so that is something that you have to think about. You know, that's a point in your corner because, you know, you're going to be well trained and especially if you are taking the initiative to learn on your own as well. I have all the books that I recommend in the description box below. The titles are there. Those are the affiliate links. You do not have to click on the affiliate link at all. You know, the title is there. That's why I leave it there. But those are books you can study with, and even though they're not part of your program, you can still get them. And yes, the years on the workbooks that I recommend, they're a couple of years old. But here's the thing, guys. Those books that are a couple of years old, they have the exact same questions as the current year books, but they're a fraction of the cost. And some of the codes have been updated, but not all of the codes, right? Because the code books do change every single year. So sometimes some of the codes that have been in the older workbooks are outdated, but you can always look to see what code that code converted to or what code it was updated to. And so that's not an issue, but it's a fraction of the cost to get an older book and you're still getting the practice that you would spend, like, you know, almost $200 for the current year book with the exact same questions in it. You know, I'm trying to help you guys out because I don't think that it's necessary to have to spend all of this money when you can do your research and, you know, look up the codes and be able to get that good practice with a really good book. Okay, so that's why I recommend those books in the description box below. Let's see, and you will learn a lot of things when you get into the field. If you are working at a hospital or if you're working at a doctor's office, I always recommend, if I'm giving my would rathers, I would always recommend working at a hospital first rather than at a doctor's office, because doctor's offices tend to be a little bit smaller, and a lot of times it's the spouse who does all of the billing and the coding and things like that, and sometimes they're not even certified themselves. And so there's sometimes a little bit of resistance that, you know, new coders can run into at a doctor's office because it's somebody else that's already there, that's already doing it. So that's why I recommend going to a hospital. You know, a hospital is going to have positions for inpatient coders and outpatient coders. And even though, yes, it's in a hospital, and you may think, well, don't patients stay in a hospital? Yes, but patients also visit the hospital for outpatient services, right? For the ER or for clinic visits. And that's where you can apply with the clinic visits. Obviously, look at the job listings for whatever facility that you want to work for. And this way you can get a variety of experience. You know, you're going to be able to be exposed to a bunch of different things. And if they ask you, you know, well, you have your certification, and let's say you pass their assessment test, because you will be tested every place you go. You will be tested. It doesn't matter that you have your certification. You also need to prove your knowledge. And so if they ask you, where do you want to code? Where do you want to go? You tell them wherever they need you, okay? You want to be as engaged as possible, and you want to be as willing to try different things. Don't be scared, and don't say, well, I want to start off in something easy, because I guarantee you somebody's in there that's somebody in there is a veteran coder, has already got the easy clinics, okay? You don't need to be worried about that. You are going to be going through the paces of a new medical coder. So they're going to throw a bunch of things at you that may seem difficult in the beginning, but with time and practice and research, they're not going to be so difficult, okay? So that's something that you have to be willing to embrace. Those who do not embrace the challenge of being a brand new coder and want to run and hide and be scared and not really kind of embrace that challenge of oh, here we go into the unknown, those are the ones who miss a lot of opportunities. And those are the ones who are complaining that they're not able to get a job because they want to say, oh, I want to work in an easy clinic, or, you know, I want to make it about me. In the beginning, it's going to be about whatever they're going to give you so that you can get your foot in the door and you can get that experience so that you can move on to do whatever it is that you want to do. If it's a particular specialty that you want to work with, or if it is just, you know, whatever it is, you know, whether it's training people, training doctors, training other medical coders, you know, you have to get that work experience in. So it's very important to be willing to take on any challenges that they have. When I worked at my first hospital, I worked at a cancer therapy research center, and then I worked at a hospital. And both of these jobs I got through a temp agency. So I always tell brand new medical coders, apply with a temp agency even before you've graduated, so that you can get on their roster and you can start getting into those positions, okay? Those health information positions, those medical coding, or even medical billing positions. Just saying. So with that said, when I first started at the hospital, the very first day that I got there, and keep in mind, I had moved 8 hours away from my hometown. So you want to talk about fish out of water? Woo-hoo! And I had maybe 3 months of experience at the time. So I wasn't a very experienced coder. I was away from home, and it was a new world. And they asked me, the very first thing was, what kind of specialty do you want to work in? I said, I will work wherever you need me. I mean, I'm here. I just moved 8 hours away from home, and I got to make this work. So wherever you want to put me, I will go. And so they said, well, we have a clinic that nobody wants to do. We've actually had 3 people quit on us. Do you want to do this? Because we really need somebody in here. And I'm like, just tell me how to do it, and I will work with it, and I will do the best that I can. And it was for pro fee coding, or professional fee service coding. So I learned that. I mean, I took to it like, you know, a moth to a flame. I mean, I didn't know to be scared when I got there. I didn't know that was something to be afraid of. And to me, I had such a good teacher with my supervisor, my friend, Jessica, that I call her my friend now, because, I mean, she was amazing. You know, she's amazing, and she's one of the best coders that I know. Literally one of the best coders that I know. And she taught me very well. And having that experience and learning that, learning what I learned about profi coding, that's what got me to my forever home here. And so that was the very first clinic I started out working here. I work at a hospital, and I started off in the profi clinic. And that was what my supervisor, when I got here, really liked about my resume and everything. And she said, you know, my resume was very impressive, and that she really liked it, and that she noticed on there that I was in profi. And I said yes. And so she was like, well, how many can you do a day? We talked about productivity. We talked about my methods of doing things. And she was like, okay. And so, you know, then I got hired on. So that's something that you have to be willing to say, okay, whatever it is you need me to do, I can do it. Because remember this, as a trained medical coder, as a certified medical coder, you are literally, this certification says that you can code for anything. And even though you have no experience in it, you can still learn it. Just as you learned to take the certification exam, you learned everything that you needed to take the certification exam, rather. You learned all this stuff. It's the same way going into medical coding. You can learn this on the job. I mean, nurses were not nurses before they became a nurse, right? They were a student before they became a nurse. Doctors were not doctors before they became a doctor. Well, I mean, of course they have residency and stuff like that, and they have all their training and things. So that maybe wasn't a good, good example. But you know, techs, surgical techs, and all of them, they weren't that before they became that, right? So it's the same thing with medical coding. So again, if you're thinking that, well, maybe this isn't such a good idea because I didn't come from a medical background, think again. I mean, as long as you have a desire and a willingness to study and to, you know, keep after the books and to keep after the coding exercises, the better off you're going to be. Because trust me, that's going to put you light years ahead of other people that are just like, I don't want to do this. I don't want to read all day, because that's what we do. We read all day. Somebody actually wrote me and said, you know, I don't like to read. Is this necessary? I'm like, how are you supposed to code if you're not reading, you know? So it's not just pushing through data, okay, guys? This is actually abstracting and looking at the documentation, comprehending the documentation. So all of these things come into play. But you can't get down on yourself just because you don't have prior medical experience, okay? So even if working in an office as a secretary, it doesn't necessarily make you ahead of the game as far as like what you're learning. I mean, you can learn just as much as a standard off the street medical coder who has no prior background in a medical office, okay? Because it doesn't necessarily translate that we all know the same things when we're walking in. You know, medical people who work in a like a secretarial position, medical front office and things like that, they know some things, and so some things are going to be very familiar to them, yes, but they still have a long way to go in learning. I see a lot of times, even people who work in the front office, they say, wow, I didn't know it was all of this stuff in coding. I just saw the codes on the page, and, you know, I saw them, you know, being submitted and things like that, but I never understood, and I never knew that there were so many rules to this. Yes, there's a lot of rules. Even my nurses find this out as well, that there's a lot of rules to medical coding. There's a lot of things that you have to know, even the little things, the details. This is why I always harp on y'all about reading the coding guidelines, because the coding guidelines that are downloadable for free on CMS, and even they're in the front of the ICD-10 CM books, most of them anyway, that's going to be all of your rules. And the more that you know them, you don't have to memorize them because they do get updated every year, but the more that you review them and get familiar with them, the easier that it will be. So at least that's my advice anyway. So but that being said, guys, you know, if you're in the program, don't start overthinking that you don't have experience, and don't let somebody else get in your head. Oh no, you have to know somebody. You don't have to know anybody. I didn't know anybody. You know, but I did go back to my school and I talked to the principal and I was like, hey, I need help because I've been applying everywhere and I can't get in. And he was the one who set me up with the temp agency. And I would have never thought to go to the temp agency. So this is my advice anyway. So I'm going to go ahead and wrap this one up. Best of luck to you if you're in this situation. If you're in school, stay in school. Stay with your studies. Make sure that you are studying for no more than 1 hour at a time. Take a break. Come back to it, you know, and then continue to study, because if you study for more than 1 hour at a time, our adult brains get very tired and it's less and less that you're going to be able to retain. So give yourself a break in that, study for 1 hour, take a break, and, you know, go back to it. So this is my advice anyway. So I'm going to wrap this one up. Thank you guys for joining me. Hit that like button, subscribe if you haven't already, and I will see y'all next time. Bye.